Now we would study about a very important orbital trauma, and the topic here is blowout fracture. Now blowout fracture is the most common type of orbital fracture, and it is basically called a comminuted fracture of orbital floor and the medial wall. Now sometimes they ask a question that blowout fracture most commonly involves which wall of the orbit. So remember, the most common wall involved is posteromedial wall. Okay. Now this orbital blowout fracture can be of two types, pure and impure. Now what is the meaning? So what happens is, in the pure fracture, the orbital rim, this is my orbital rim, so this rim remains intact. And in impure fracture, the rim is also damaged. So these are the two things that you should be remember regarding the classification of blowout fracture. Now in the blowout fracture, you can see these two images which specifically show you two important signs. The one here is called teardrop sign. Now what is the teardrop sign? As you can see here, that this is my maxillary antrum. So the intraocular content has herniated into the maxillary antrum. And this sign is called a trapdoor sign. Now what happens in a trapdoor sign? You can see like this. Now the doors have basically there, and they have trapped the intraocular sign. So the chances of gangrene are very high, because this can lead to the compromisation of the blood supply to the various contents. Okay. So what happens in a trapdoor sign is that the inferior displaced bone recoil back. Okay, so this has recoiled back, and it basically acts like a hinge. Okay, this is called hinge, and what it does is it basically traps the contents. So two important signs they ask: trapdoor and teardrop. You remember they are talking about the blowout fracture. Okay. So now what are the clinical features here? The clinical features of the blowout fracture that you have to remember is diplopia, because you have the muscle restriction. Then you can have inophthalmos, or sometimes even exophthalmos, because there may be blood there. Okay. And you can have restriction of the extraocular muscle movement, and when the extraocular muscles are basically injured or basically compromised, this can lead to a reflex where there is a loss of the heartbeat. Okay, there is a decrease in the heart rate, that is called oculocardiac reflex. So even in congenital cataract surgeries, congenital squint surgeries, wherever you touch the muscle, there can be a oculocardiac reflex. This was also a previous year question too. And whenever you see oculocardiac reflex, just leave the muscle and give the atropine to the patient. There can be the air oozing into the other cavities from the maxillary antrum, because that is the wall is damaged. So this can lead to emphysema, and there may be damage to your infraorbital nerve, which can lead to the numbness. And you do a CT head and orbit to basically see the extent and the type of fracture. Okay. So the treatment is that if there is a basically a lot of damage to the orbital floor, you can do orbital floor reconstruction. And very important is, if you are seeing that there is a oculocardiac reflex, there is a diplopia, in that cases you basically reposition the entrapped muscle. That is so important. So these are few important points you should be remembering regarding the blowout fracture, the most common type of orbital floor fracture.